We're going to give you each about 3 or 4 minutes because we would like to have another question as well. So,
thank you, Deshanka. I knew that was going to happen. Thank you. I knew that was going to happen. That's what I said. I'd like to take two perspectives, one from my research lens, and the system there I would think about is the knowledge creation system. This we haven't heard about, but I'm going to just name it that for the moment. And with the knowledge creation system, I feel as though one gap is the integration of the evidence that we have in terms of relationships between oral and systemic health. And when I say the integration, is also the broad awareness across disciplines and across professions. We often learn that, oh, I didn't know that diabetes has an impact on oral health. For example, that's one of the experiences that I have from many different healthcare professions. So in that regard, I'd like to mention that there is evidence and an evidence base to drive much of the efforts to integrate oral and systemic health in primary care, particularly when dentistry is essentially a primary care profession. It's an ambulatory care service providing primary care for the most part. Of course, we have the specialties, and yet this dissemination of the evidence, in my experience, is not as broad as we would expect. For example, we did hear about programs that address pregnant women, and of course, in that regard, there's an emerging evidence for the impact of oral health, most particularly periodontal health, on women with gestational diabetes. That would be a two-directional relationship as well, where we have found that women who have gestational diabetes are at greater risk for adverse maternal outcomes. And using a composite measure, colleagues at the University of Kentucky, this would have been Karen and Michael Novak, conducted a longitudinal study to follow women with gestational diabetes and found that women with gestational diabetes had greater risk for developing periodontitis and worsening periodontitis, as well as with the composite measure of maternal outcomes, a greater risk for having adverse maternal outcomes. So that would be that use of that evidence, as a basis and as a motivation for the integration becomes an enhancement to the programs that are focusing on women, on pregnant women. Another aspect that we haven't talked about when we look at the age spectrum would be the geriatric population, particularly the geriatric population in long-term care facilities. There's a strong evidence base. There are also meta-analysis and systematic reviews with respect to how oral health care in residents of long-term care facilities can have a reduced risk for aspiration pneumonia, which is a major outcome, adverse outcome in the long-term care facilities. An area that gets a lot of press and probably has less evidence, and yet there's no reason to consider it. In my opinion, an area to omit. It would be atherosclerotic cardiovascular diseases. Gets a lot of press, and yet the evidence from interventions or longitudinal studies is probably not quite as strong as some of the other conditions. And we've heard quite a bit about diabetes, and I think it's quite appropriate for that to be one of the focus areas, because there are numerous longitudinal studies that have provided evidence that Periodontitis adversely affects glycemic control. Periodontitis is also associated with complications of diabetes, and also that diabetes worsens periodontal health. There have been several meta-analyses of smaller scale studies that have provided evidence that glycemic control, the level of hemoglobin A1C, can be reduced by about 0.3 when we include a study conducted, a multi-center control trial that found no evidence of an effect of receiving periodontal therapy. That was a study, probably that was the largest multi-center study, and would have been considered a landmark study had it found an effect. And yet, when we look at meta-analyses that include that study as one that did not provide a benefit, the meta-analyses of others, of a large number of other studies still support the idea that hemoglobin A1C or glycemic control is significantly improved by receiving, this is non-surgical periodontal therapy, the kind of care that people would have. Is that 3 minutes? Oh, my goodness.
So
Okay.
well, we will have time to continue
Yep.
on as well, but